So I've put together a PowerPoint, and I know that that can be not always the nicest thing to view on the screen in this kind of situation. But what it does mean is that we can make this available after the presentation, along with a recording of today's webinar. So that means that you can go back and look at anything that you would like to. You can use any of these slides to share with colleagues or to put out in your own media. All we would ask is if you use any of the information today that you just reference us, Dorset Community Action. That's our only ask. Otherwise, all of this is free to share. I will make sure that any particular guides that I think are useful will also be alongside this guidance. For example, ACRE produced a really nice Tier 4 document to support village halls and community buildings. It is Tier 4, so some of the guidance in it won't be 100% accurate, which I'm hoping to tweak today, and then we'll be able to put on some refreshed guidance. But we will attach any of that along with this presentation and the slides. Okay, so as we move into lockdown 3, we thought it would be kind of useful to revisit some old themes, but also to look at the current new guidance. On this very first sheet, we've got the link here to the updated guidance for lockdown 3, and this will take you through all the summary guidance. The legislation is now available. It went live at midnight last night. I've only had time to look through the update from the legislation, and I've corrected any in our slides where those updates have been made. But actually the legislation is very, very similar to the legislation that was produced for the second lockdown. There has just been some further restrictions around outdoor activity, particularly outdoor gyms and things like golf clubs and outdoor courts, sports courts, which are also closed. So there's been some slight tweaks along those areas, but a lot of it is very similar. Okay. So this will seem very familiar, particularly to anybody who was around in March. This is really being used as the big slogan now, although face space and I forgot myself, face space and hands is still very much being used. We have gone back to this very simple message of stay at home, protect the NHS and save lives. So this is worth revisiting if you had any of these posters up in kind of March as we went into the first lockdown. They are worth bringing out and reusing. It's a very simple message, but it does drum home that one of the main reasons that we are doing what we're doing is to protect the NHS. As we go through winter, which is always a very difficult time for the NHS, when we put coronavirus on top, particularly as it is spreading more rapidly with the new variant, we are seeing the NHS under considerable pressure. Not going to be under pressure is under pressure. So I think it is quite important to go back and sort of revisit that very early lockdown poster, and it is quite useful to use. So just a sort of summary of lockdown and where we are at the moment. As the slogan said at the beginning, stay home. That's really the big guidance, is if you can stay home, stay home. So if you can work from home, work from home. If you can study from home, study from home. So that's really the big message. And there are reasons why you're able to leave home for essential services, of course, to go shopping, to get medical advice or medical treatment, and to go to work if you can't work from home. Volunteering has also been added to that list. And that's really significant because last time it was sort of an add-on that came later, but it's kind of front and center this time. We obviously would like people to volunteer from home as much as possible, but when we're looking at quite a few of the things that are going to be needed over the next few months, things like shopping or prescriptions, then it could well be that we need people to be actually out and about, but we want people to volunteer as safely as possible. And again, I would signpost to our early guidance that we used around volunteering safely, as that will still be applicable for this lockdown. Exercise is actively encouraged. We all know that during previous lockdowns, we've had a propensity perhaps to put on weight, maybe drink a little bit more than we used to, and to stay in and not do as much exercise as we're not moving around the world in the way that we normally do. So it is important to inbuild that exercise into your daily routine. And I would say take the opportunity to try and make this a January New Year's resolution to put that exercise back into your life. We saw an awful lot of people during the early first lockdown out and about taking good exercise, taking the opportunity of being furloughed as an opportunity to improve their take up of activities outside. And really, that's something that would be good if that could happen during this lockdown as well. People who are being asked to shield again are also being encouraged to take exercise. So that daily exercise is really important. You can do it with one other person outside of your household as long as you maintain the rules around social distancing. And if you can't social distance, so if you're crossing each other on a path or going over a stile or something like that, then actually it's making sure that you mitigate those risks as much as you possibly can, which could be masks. It could be by making sure that you don't touch. It could be by standing one behind the other, whatever it might be. You mitigate the risk in areas where you have to break that 2-meter rule. Otherwise, stick to social distancing. Don't meet others. Now, we will talk about this. There are some circumstances where you can meet others, but in a social context, that isn't allowed during the lockdown. Support groups of up to 15 people can still go ahead. If you care for somebody or you offer respite support for somebody, that can still also happen. So there are some times when it is possible to meet with others. As we know, schools and colleges have closed, as of universities, and they're encouraging remote learning. But if you are a critical worker, if you're part of the frontline response or you're a support for the frontline response, then you are able to send your children to school. As voluntary services, if you are providing a frontline response, that also includes you. And travel, we need to restrict that as much as possible because, of course, it's encouraging spread. So when you are exercising or if you are going out for essential food and services, try and keep it as local as possible. So think local first. Where's my local shop? Where's my local park that I can walk in? So think local before you get into your car to travel any distance. So just have to look at those in just a little bit more detail. These are the reasonable reasons for leaving home. So work, as we've said, work from home if you can. If you can't, you are able to go into work. Volunteering is a reasonable activity to be out and about. The volunteer centre will provide people with badges so that they can, one, show other people that they're volunteering, but also so they feel secure that they're not out breaking lockdown rules, as will other charitable organisations. Essential, that looks a bit weirdly spelt. You always spot it first on a big screen. Essential activities really does mean things like picking up your prescriptions and getting food. So it really is things that are essential. Education, childcare. Childcare is permitted. Nursery schools and early years provision is still open. Meeting others and care, as I've already mentioned, there are some allowances around that for support groups. Medical reasons, very important as well. Harm and compassionate visits. If you are at risk of harm, then you do not have to adhere to lockdown. Probably one of the biggest messages that we need to get across to people is that you are not trapped at home if you are suffering harm. There are support services out there. They can be accessed by people, but you can also go to friends and relatives if you are at risk of harm. Compassionate visits are also allowed. So if you have a member of your family that is in a care facility and is dying or is seriously ill, visits are allowed for those compassionate reasons. Animal welfare, which got missed, I think, quite a bit off the previous one, but I think as any person who's interested in family welfare or their own pets will know that actually it's unlikely that anybody would stay at home if their pet was in distress. But it is important to state that that wouldn't be breaking the law. Communal worship and life events. So weddings are permitted, but only if they are time sensitive. So if there isn't a justifiable reason why it can't be delayed, then that is a permitted wedding. Otherwise, they are to be delayed. Funerals can continue, obviously, up to 30 people can attend a funeral. And for events that take place after a funeral, up to 6 people. They've not used the word wake in a lot of their guidance, I think because it implies a kind of social indoor drinking event. So when they talk about celebrating somebody's life, they tend to talk about something that might be held outside, like scattering of ashes, that kind of event. Buying and selling a home is still permitted while we're in lockdown, as is voting, should that become an issue. So the clinically extremely vulnerable were a group that were highlighted during the Prime Minister's speech on Monday evening. And we are using the term shielding, which was kind of at the last lockdown was sort of not being used, but it is being used now. We are encouraging people who are clinically extremely vulnerable to shield. There won't be quite the same support that was there in the first lockdown, so there won't be food parcels being delivered and that kind of thing from statutory providers, but there is support still out there, and it's really important that we get that message across to people. An awful lot of the local voluntary response groups that were operational during the first and second lockdown are operational again. We've got considerable numbers of people coming forward to volunteer in Dorset. I think it was about 500 that had put themselves forward in one way or another just since the lockdown had been announced, which is extraordinary. So we are seeing that kind of response coming back from people. So the support is out there for anybody who needs it. One of the ways of which people can access the support is by contacting the council directly. Anybody who's clinically extremely vulnerable will be written to, and that will tell them exactly how to get support. But if they haven't received the letter yet, then they can contact the council directly. And of course, they can contact any of the local support groups that we'll talk about at the end of the presentation. They can also register on the link that's at the very bottom for support, and that can help them to get priority shopping deliveries, for example, and it is worth doing. They will need their NHS number, which they may not know about, but it does state that on any guidance that they need their NHS number. I think they can still register without it though, but it is helpful if they do have it. If they've registered for previous lockdowns, they don't need to register for this one. They'll be able to continue to use the same priority shopping services they were before. So we move on to the closure and restrictions that are on businesses. As I say, if you look at the legislation, there are very minor amendments that have been made to the legislation that was written for the amendments that were made for the second lockdown. So actually it still stands very much as it did before. This is still covered within part 4 of the legislation, section 18, subsection 9, for those nerdy enough to want to go back and actually read the legislation. But it does highlight that a person who's responsible for a community centre or hall must close that hall except for particular circumstances. And those are to provide essential voluntary activities. And we'll talk about that in a little bit more detail in a moment. Education and training, and support groups up to 15 people. And also childcare provision under Part 3 of the Children's Act and supervised activities for children. It is important to look at that in a little bit more detail in the guidance, because there are some activities like parent and toddler where it's recommended that you should only have about 15. Children under 5 aren't counted as part of that 15. So it's really talking about the adults that might be present as a parent and toddler group, but it is worth having a little look at further guidance on that. That hasn't been clarified through the legislation. So going back to those sort of the support groups and the type of groups that are allowed, this gives really a flavour of that. This is not an exhaustive list, but it gives kind of a flavour of the sort of thing that support group means. So people who are recovering from addiction, new parents, people caring for anybody with long-term illness, LGBT plus groups, people suffering bereavement, vulnerable young people. It gives a flavour of the kind of charitable and benevolent groups that might well be running at this time. And if you have management responsibility of a village hall and you were previously offering support for these groups at your premises, that can continue under this lockdown. So that's one of the areas. It's worth also looking at the fact that there are other areas that community halls can stay open for. So we talked about work. I know that some village halls have actually opened up their doors to allow people to be able to work remotely in their premises, and that can still continue because going to work is still a permitted activity. So if that's something you have done through your village hall or your community building, that's something that can continue. Food and essential retail. So if you're a community shop, you fall under that. And in some communities, you're more essential than any other, I would argue. So it is really important that you're able to continue to sell. Takeaway food and drink services, again, are also permitted. They have brought in an alcohol ban, but I would have guessed that many of you probably weren't doing takeaway alcohol anyway from your premises. Libraries are allowed to remain open for digital access to public services. And so really it's quite reasonable to extrapolate from that any community facility that is also offering access to digital services is able to still continue to run. It is essential that we try and help as much digital access as possible. And it's worth mentioning at this point that there are some providers, some internet providers who have actually got on board with the government to be able to provide to be able to provide data, additional data for mobile phone users, and also broadband routers that can be put into people's homes. This support can be accessed via local councils, and if you look at internetproviders.gov.uk, you should be able to find the link. I've actually put it on LinkedIn as well, and I'll make sure that that's available as part of these notes. But it is really useful. It's probably worth mentioning some of the providers. I don't want to really sort of highlight one in particular, but some of the providers are only offering it to those who've got a monthly contract, which we know people that are more financially vulnerable tend to use pay as you go. But there's still quite a few people who are struggling to be able to access any kind of digital services, whether that's education or whether that's food shopping, apart from by using their phone. And of course, the cost of data is exorbitant. So being able to be given either unlimited or up to 20 gigabytes of additional free data can really make a big difference to somebody. If they don't have good connectivity in their area, then a broadband router might be more useful. Or if they have access to laptops or tablets, again, broadband router might be more useful. So these are things that you can support your community to be able to access. So that's the main guidance as it stands. It hasn't changed greatly from the previous lockdown. There are just some tweaks to it. But what I thought was probably particularly important to cover at this time, as opposed to the second lockdown, is reminding you about your contingency planning. So this lockdown is going to go on till at least mid-February. That's more or less the guidance that we have been given. So it could end earlier if we see numbers come down, if people's adherence to the rules is particularly tight and we see changes again with the variant to actually see it slowing down in pace, or we see through vaccinations the spread being contained. But we probably should plan for about mid-February. If vaccinations aren't able to be rolled out at quite the speed that's been predicted, then it is possible it could extend even a little bit further into the spring. So it is really important to look at your contingency plans. Now, many of you will have done this back in March. You do not have to reinvent the wheel. Get your contingency plan out that you did in March and review it. So we'll start there really. What is a contingency plan and what does it look like? This is a really simple designed contingency plan, and it doesn't have to be a great deal more complicated than this. What you will find though as you do it is you begin to have more and more subsections. So as you start to look at things like staff, team and office or field working, you might begin to break that down into several different sections. But these are just broad headings, really, tasters, just to get you thinking about how you might put one together. And it's really looking at, first of all, how you mitigate that risk. So what you're going to put in place. Now, that could be closing your business. And that would be a way of mitigating any risk. Apart from, of course, there will be financial implications that go with that. So you will still need to look at, as a result of closing, what other risks does that hold for your organisation? Then you might need to look at what resources are needed. So that could be staff time that might still be needed in order to keep a premises safe. It might be that you need to contact your insurance provider if your building's going to be closed to make sure you're not in breach of your insurance. And then when you're going to review it by, and who's going to do the reviewing? If there aren't any staff working for your business, then who's going to review when it's safe to return? So there will need to be something inbuilt into your contingency plan about how you monitor opening up again, even if it's just literally a crew deciding on a date for reopening. So this is worth going back and revisiting. We have resources that are available on the DCA website under our COVID-19 page that will help with all of this. And of course, you can book to see an advisor to go through any of this that you might be unsure about. So once we think about our contingency plan, we start to think about recovery. We hope, obviously, that we will come out the other side of this, that there will actually be a restart for all of our businesses, for all of our services that we're offering. So we do need to, even now, start thinking about the questions of how we might restart, what we might need to change, and also what funding might be needed to bridge the gap between where we are right now and being back up and running. And these are important questions to be asking now. If you're asking them in the middle of February, it's going to be really hard, for example, to get a funding bid in and get funding secured, ready for when you may be reopening. So start asking the questions as soon as possible. The aim is that you will have a plan for gradually restarting. So not some date that you work towards that you just go, that right, we reopen, open the doors and off we go. And businesses, excuse me, after the last lockdown that did find themselves in quite a lot of difficulty because they were either oversubscribed, which made it really hard for them to keep hold of what they were doing, or what they found was that they didn't have the staff in place with the expertise in place to be able to deal with queries and things that came through. So it is really important that you work out a gradual restart, which could be informing staff, it could be checking staff training, it could be getting facilities clean and ready to reopen, and then a date that you're going to reopen. So it is really important that you think about it in a staged way and don't just think about waiting until you hear what the end date for lockdown is. And these are kind of the important things to remember right back in March, and I think it is worth reviewing them. We need to make sure we take care of people. Now, obviously, that includes family and friends and loved ones, but it also means the people that we work with, we volunteer with, and our community. This is stressful. And going back to a point that we've been before, can also feel more stressful than it needs to, because it can feel like March all over again, and it isn't March all over again. We're in a very different place to where we were in March. We have a vaccine that's being rolled out. We know much more about this terrible virus than we did back in March. We've got better preparations in place to be able to restart businesses than we had back in March, when we were kind of learning as we went. So it is important that we don't go back emotionally and psychologically back to where we were in March. And one of the ways that we can prevent that is by taking care of people, being there for one another. Governance is still really important. We need to make sure that the governance is flexible enough to be able to support quick decision making. I think schools would probably state that more than any other institution right now, as they moved from Sunday to Monday evening. But it is important that you're able to make quick decisions and make quick responses at this time. So boards, I would still recommend that you're meeting, that you're virtually meeting, but that you are meeting to make sure that the support is there for your organisation, or that if things do arise, that you're able to support quick decision making. As I said before, look at a phased recovery. This is about milestones. This is a marathon. It's not a sprint. So work out what you're going to do, when you're going to do it, and how you're going to do it. And remember that we are here. DCA are here. We were here all through the other lockdowns, and we're here through this one to support you with that milestone planning. And we will be doing our webinars as we did before to make sure that we're able to give the best up-to-date advice. And you can book to see one of our advisors to be able to talk through those milestones and what you might be doing, including funding. If there are new risks, then there needs to be a new plan. So think about your risk assessments as well as your contingency plan, and think about whether you need to redo them. You probably don't need to write them from scratch, but there may well be some updates or some revisions that are needed. For your own sanity, don't overpromise or overdeliver. It is really important at this time that we're realistic about what we can achieve. If you're furloughing staff, you're not going to be able to ever offer the same level of service as you were before you furloughed staff. If you've got staff that are being furloughed this time for childcare reasons, and so your capacity is going to be down, then again, make sure that you look at that. What are you able to achieve, and be realistic? Because all that happens otherwise is that we end up with exhaustion, or we end up dipping so much into our reserves that we don't have a business when we come out the other side of this. If you are able to take a break from service delivery, then try and do something constructive with that break. Training is really good and really important, and we can signpost you to quite a lot of free training that has been made available. I do also believe Joe Wicks is starting up his Monday 9 o'clock PE lessons. So even if that's just the only toe that you dip in the water for some training, might not be a bad one to start with. Don't forget external communication. Your customers may not be coming through your door, but it doesn't mean they're not interested to hear from you. They'd like to know what you're doing. And if you're changing your business up and you're offering more of a community support response, make sure people know about it. We can support you with some of that. Contact us if you would like us to promote services, things that you're doing, communicate with your community. We have a fantastic e-news bulletin that goes out from Ray. It goes out every fortnight. It's really interactive. And if you're not signed up for it, make sure that you do. But we can also promote other services in there. We can let people know in your community what's going on. So contact us if you'd like to be included in our news. And use staff effectively. Think about how you might be able to manage furlough more flexibly than maybe you might have done in earlier lockdowns. Think about how you can slowly bring staff back and how that can aid recovery, and also make good use of volunteers. So as well as taking care of our business, it's really important that we take care of ourselves. And for any of you that have been with DCA for the long haul, this diagram will be quite familiar. I do seem to use it quite a lot. But it's really important that we recognise where we are. And these are seen as the 3 stages of a pandemic response. And for a long time, many of us will recognise that survival mode, that glued to the news, checking social media every 5 minutes, looking to see what the updates are, feeling very unproductive and lethargic, as well as working at a level that probably was causing stress and strain. It's important that we don't remain in that survival mode, though. We've gone through many stages through this pandemic, and many of us will have hit growth, feeling calmer, being able to live in the present a bit more, being kinder to yourself, feeling more connected as a community or as a service or as part of something which you may not have felt before. And we mustn't lose sight of that. And so try and remain in that space that you were before lockdown. Try not to fall back into that survival mode. We're not in the same place that we were in March. So when we talk about taking care of each other and ourselves, it is very, very important that we focus on that growth element of what we've developed and what we've gained through this experience. I don't think Dorset has ever felt quite as connected as it feels right now. And that's something to celebrate. And as we move into lockdown 3 and we see people coming forward to volunteer again, we see groups standing up, ready to respond in their local area, I think it just shows how far we've come. And it is important that we don't lose sight of that. So as we talk about taking care of ourselves and others, it's kind of important to know what we're looking for. If we've got our antennae out, if we're using our eyes, if we're listening to people, what exactly are the signs that we're looking for? And these are some of the symptoms, not all, but some of the symptoms of stress. And I think one of the best things is taking a moment to look at ourselves and to recognize what we ourselves might be feeling. Because for as much as we may want to help other people, if we're not coping well ourselves, that will impact on our ability to be able to support others. Earlier, I talked about that not exercising as much, maybe eating more as a comfort, as a thing that you can do inside safely, that you might be drinking more than you normally do or smoking more. Well, January is traditionally that time of giving up, and it may not feel like a very good time right now to be thinking about those things, but actually it is. And there is support out there. Live Well Dorset, for example, a really good support service that don't just tell you that you should give up those things, but actually hold your hand and take you step by step through the steps you need to be able to make those kind of life changes. And actually, that can be a really healthy way to cope with stress that's going on, doing something positive, doing something that actually matters to you and makes a difference to your health. And of course, would also argue can make a big difference to your risk factors when it comes to COVID-19. So probably never more appropriate than it is right now. So take a moment to think about yourself, to look at the list and see whether there are signs on there that actually feel a little bit too familiar, and recognise that you deserve support just as much as the communities that we spend our time supporting. But also look out for other people around you, to see people that might be struggling and to be there for them. There is support available in practical ways. There's some support through Dorset Council, who, as I mentioned before, they will be writing to people who are clinically extremely vulnerable. And there is support and guidance on their website, which you can click on from this slide where it says we can help you. There are support payments about people who may need to have to self-isolate, which can make a big difference for that, that isolation period they may have to go to if you get a positive result. There is also help available for anybody who's struggling with finances. And again, this isn't just for us, this is to make sure we promote this as widely as possible to our community. So even if your service is currently closed, if you're looking at putting out a flyer or an email to people who've previously used your service to say thank you and that you'll be back, include some of this support so that people know how to find out what's going on. There's a really useful document from Citizens Advice around being furloughed. And it's really nice because it's written not from the point of view of the employer, but from the employee. So it makes it a really accessible document. There's support available for businesses. And as we've talked about, taking care of yourself is also part of taking care of your business, but sometimes your business needs a little bit more attention at different times. So the job retention scheme is still open until April. It was extended back in November, and as a result of that, it is only available for people who were employed before the 30th of October, because it's still reliant on that cut-off date. We don't know if that is going to be updated because of a new lockdown. Previously, when new guidance on furloughing has come in, that date has been moved accordingly. But of course, the actual job retention scheme hasn't changed from when it was altered for November the 1st. So we don't know. So as it stands at the moment, somebody has to have been employed by the 30th of October. There are extensions to the Self-Employment Income Support Scheme. And there is also financial support for people who are off work due to coronavirus. So that's there as well. You may also be aware, and I did skip it at the beginning, and that's because we don't have any further information at the moment, but the Chancellor did announce that there will be some further one-off top-up grants for retail, hospitality and leisure businesses, which of course will also include village halls and community buildings. The first part of that grant, the largest amount, I haven't put it on here actually, but it's I think 1.4 billion, I think, off the top of my head, is going to be available for businesses that are closed. So if you are closed and not open at all, you'll be eligible for the first part. The second is the discretionary fund. Now that can still be incredibly helpful to any businesses that are currently operating but are working at a smaller amount of income than they would have expected to receive at this time of year. And you can use what you received last year, what your income was last year, as a basis to prove that. So the discretionary fund will be really important for any village halls, community buildings, charitable services that are still running, but you're not making the kind of income that you were making. It can also mean that village halls can continue to offer support services without necessarily losing out because they would be better off if they closed, which is not a situation we want anyone to be in. Back to that personal support that we talked about, these are some of the support services that are out there, and these are definitely worth having as telephone numbers. For individual support, you've got the struggling telephone number for the 0800 144 8848, which is the Citizens Advice Helpline number. And for groups that are struggling during this time, remember that's why we're here, and it's what we're here to help with. We have a helpline that is open between 1 and 4 on a Tuesday. We will extend that service if the need is there. So if lots of people are ringing during that time, we will extend it. But we do have other ways that you can get hold of us. There's an inquiry form on our website. We also have an inquiry email address. And you can contact us through requesting to see an advisor as well. So please do make use of the services that are available to support you. There are also quite a few organisations and services that are out there to support people around supporting staff and volunteers. And there's quite a bit there about preventing stress and helping people to manage how they're feeling at this time. You know, we mustn't really underestimate just how stressful it is for people, and for voluntary sector services that have continued throughout this pandemic, have stood up, been counted, have delivered more services than they normally did, have been more responsive than probably any other sector. It is really important that we don't overlook the needs of our staff and our volunteers. And there is help out there. So if you're a manager, or if you're somebody that supervises or supports, or you're a part of a board of trustees, do look into some of these toolkits to see if they'll help your staff team, your management team, or your team of volunteers. And we have local support. This is probably a good opportunity to mention the fantastic local community support groups that stood up around Dorset in such an extraordinary way back in March, and many of them have continued to operate throughout the entire period that we've been going through this pandemic. And for that, I can only say a massive thank you. Some of you may not have continued to operate. You pulled back because staff went back to work, or your volunteer team reduced down in size, or you were working in a very small geographical area, but you may want to stand up again. And it's just the same process, getting in contact with Volunteer Centre Dorset to get yourself back up together. If you want to check to make sure that you are being recognised and people do know that you're out there, check out the Help and Kindness website as a good way to make sure that your service is actually being supported and promoted across Dorset. We are going to need volunteers. We are going to need that support. It almost goes without saying, there is going to be a greater need as we go into lockdown. There will be families that are struggling. There'll be older people. There'll be people who are clinically extremely vulnerable who are going to need additional support. And so any help that is being offered will be gratefully received. And the Volunteer Centre Dorset telephone number is on there. Age UK also have a wide-ranging amount of volunteers that have worked as part of the pandemic response, particularly on helplines. And telephone befriending has become a real growth area during the pandemic. And so people are needed, and not to think that that's something that went away back in March. It's still really vital support. And I thank you for everybody who's been part of that response. And there's another ask. So as I say, for all of you that have been part of a community response, that's been really greatly appreciated. But as we move into the next phase of this pandemic, which is vaccinations, we are looking for some very specific volunteer support. Vaccination marshals are going to be needed as we move particularly into mass vaccination. So as we move from that very tiered response that has been talked about a lot by Chris Whitty, went through those sort of 4 tiers of people that need to be supported, from the most clinically vulnerable through to, older people, clinically vulnerable, to healthcare workers, to NHS workers. As we move through those and we move into more of the mass population, into the over 50s, we will beginning to see more community mass centre, I shouldn't really say mass, it sounds awful, but community vaccination centres opening up in order to be able to get to the wider population. And as we do that, we are going to need volunteers to help with the management of people through those vaccination centres. So not the administration of vaccinations or the paperwork involved in that, but the supporting of people through those facilities. People are going to turn up anxious. People are going to turn up very unsure of what's going to happen. And as we know, a volunteer supporter to be able to guide, to be able to point to the right place, to be able to walk somebody to where they can get help, can make a massive difference. So in order to be able to register for this, we're doing a central registration for across Bournemouth, Christchurch, Poole and Dorset. And that's the link there for anybody who's interested. You can contact the Volunteer Centre directly, as you can Community Action Network if you're on the border of Bournemouth, Christchurch and Poole, or you have offer services across that way. But they're doing it in a combined effort so that we can pool volunteers as much as possible to be able to offer this support. So if you yourself are not able to volunteer, but you know members of your family or your friends who've been furloughed and they've been talking about wanting to do something to support this, this could be a great opportunity. So please do pass on this information. This will also be included in our e-news as well, just to make sure we're getting out the message, and it is available on our website as well if you want to visit there. So finally, if those land girls can teach us anything, it's that we can do it. We can do it. We can get through this lockdown. We've got through 2 previously, and many smaller tier 4 and tier 3 restrictions. So we know we can do it. This is not blind hope that is taking us forward. It is a realization that we can do it. That doesn't mean blind optimism. It's very important to be realistic, as I said before, about not over-promising and over-delivering. But we can do it. Dorset can, Dorset has, and Dorset will. And that's down to people like you. Everybody who's here today who has an interest in our sector or has been part of the phenomenal community response here in Dorset has proved it. And we will continue to support people. If there is further help that we can provide, if there are things that you wish DCA had done last time and we didn't, or there are things that you think would be helpful, we're always interested to hear from you. We are literally a couple of clicks away. Go to our website, go to our inquiry form and literally just ask the question, make the request, ask us to do. I'm always happy for people to email me. I hope I won't lose you in amongst all the 300 other emails that are in my inbox, but I'm always happy for people to email me to ask me questions. We want to make sure that we are meeting the needs of you as a community response as much as we can. Thank you for those of you that have posted questions in the chat. As I said to you before, we will hopefully have answered some of them as we've gone through, but we will make sure that those questions are recycled at our next event on the 13th, when we will go through further updates on the government guidance, because there will be more that's coming out. As I said, quite a few bits of guidance are still referring to the tiers, so there's still a little bit of work on the government guidance pages to come forward. We will be doing an update around vaccinations at our next webinar. And we're also really lucky because we're going to have Kirsty Pemberton from Citizens Advice, who's going to be coming to tell us about the EU settlement scheme and about how we can support our communities to make sure that they are registered for settled status before the deadline in June and before the support runs out in March. So it's really important that we're getting that message out as far and wide as possible. So that's our next webinar, which I really look forward to seeing you at. I'm just going to go to Julie now just to ask, were there any particular questions that we weren't able to answer that you think I might be able to?
There was a question about funding from Dorset Community Foundation, which I didn't actually answer at the time, but their funding is coming to an end this month, and as far as I know, there won't be any new strands of funding till about March, but we can double check that and confirm that. And the only other question that we haven't covered, which we will be covering next week, you said about vaccinations, but somebody has asked about applying for staff working with vulnerable people to have vaccinations as key workers.
So thank you for bringing that final point up. We were part of a group that lobbied very hard to get testing being rolled out to supported living accommodation for key worker staff for adults with learning disabilities. And we were actually able to get that introduced. Public Health listened to the points that were made and they rolled out testing in those facilities. So it does make a difference if we raise our voices and we send that message out. There are an awful lot of disability activist groups that are lobbying the government right now on that very point. They are covered partially within the clinically extremely vulnerable, but they are not exclusively covered. So I think people with Down syndrome are covered within clinically extremely vulnerable, but there are a lot of other conditions or people that have conditions such as cerebral palsy, who also have breathing difficulties as a result of that disability, which makes them very susceptible. We also know that they have disproportionately been harder hit than actually any other group by COVID-19. So we should be lobbying hard about the vaccinations, and we are. And we will continue to, along with other organisations. It is worth going on to MenCap's website if you're particularly interested in this issue, because they actually have part of a campaign. And of course, the more voices that are raised, always the better. So thank you for that. That was a useful point to bring up. We will go into vaccinations and things that you might need to know and advice so that you feel confident if people are asking you questions about vaccinations. We will go into that into more detail on the 13th. And I really look forward to seeing everybody there. So thank you for today. Thank you for your phenomenal attendance. Blimey, we put out a message one day and we get 85 people turn up the next. That's not bad going, is it? So thank you, everybody. And I look forward to seeing you all next week. Take care, keep well, keep safe. Bye-bye.